Yes, I want to be brief. I think part of your presentation, it's a very wonderful presentation. As part of it, there was a question about whether low-cost sensors are the answers, even though you were not definitive about it. But I believe we can say to a very large extent that low-cost sensors are very promising. And I want to tie this to an earlier question that came about the estimates, 5 million, that's against 7 million, and we've seen other estimates. And I think Steve, in his contribution, did a lot of good work. But definitely what I believe, and I believe others also believe, is the fact that, in fact, we have to indeed do something about air quality monitors in low and middle income countries, because unless we do that, the estimates will continue to change or will continue to differ. But as we get a lot more data, I'm sure it will make it more accurate. And for that reason, it will minimize that unfortunate issue that we are all not happy with as scientists. So I want to tie in again to the issue about standardization for the low-cost sensors because of the promise that it holds for us. And probably bring in the EPA, and of course, not just in Ghana, but across the continent, to see how we could, be able to get our governments to, get buy-in, and then see how they can also support to get these sensors across so that we can get a benefit to kind of mitigate the challenges that come about. Thank you very much.
Thank you. There are a lot of things I did not say because of time. You could see I was skipping. I want to say that in Lagos, we're working directly with the LASEPA, Lagos State Environmental Protection Agency. So all the deployments we have a collaboration, MOU. So we do it together, and they assist us also to get permissions from where we cannot access. So we deploy together, and we also access data together. And so in short, what I showed you is LASEPA that has been daily, picking those maps and then putting on a platform. And so that question is low-cost sensor. The answer, very much yes, because all this while I showed you what we did, the passive sampling. I've been on it since 2015, but nobody has said anything. Nobody knows anything. And the active, been on it since 2017, and then nothing much because of the cost, sampling and analysis, and not able to spread and so on. But these low-cost sensors is just this 2023 that we started this work with this funded work thanks to U.S. Embassy, U.S. Department of State. And as we got these results, I can tell you that the ones that the public have seen, they've been calling us, people are now aware, and people are now conscious. They're trying to see what can they do to stop this? What can they do to control it? And at the same time, LASEPA is also on their toe, And so this low-cost sensor is it. All this while, all those things, or the passive and the active I showed you, is just one or two locations. and that passive has been one location all that while. But this one, with the low-cost sensors, we have 30 locations. And I want to mention also, it's not just us. We have the Nigerian Institute of Medical Research also that is also deploying. And we have Dr. Adetun here, who is from that institute. So we're working together and it is spreading. So, and it's cheap and easy to deploy. And so low-cost sensor is really helping because different locations that we never even thought that are issues, we've discovered that there are issues because the hidden activities we never saw, we never knew, just revealing that something is going on. And we've been able to trace that, oh, this is the reason why this is happening here. So in short, to a very large extent, low-cost sensor is the answer. If we can get the gaseous sensors in addition to these PM sensors, and then happily now we have the reference monitors, which is going to give us reliable data in Nigeria. So low-cost sensor really is it. Thank you.
My name is Adetun Mustafa. Thanks so much. I'm from the Nigerian Institute for Medical Research. I just want to go deeper on some of the things Dr. Alani said. If you can go to your slide that talks about the limitations of gaseous monitors, if you can go there. And that is why I'm glad Raphael Ako is here. Kofi is coming on, I think on Thursday. And a couple of other people who have been doing air quality monitoring. I'm an environmental epidemiologist, and I will speak from that perspective. I think one thing we need to be very careful about in the low-cost sensor, they are good, they are able to penetrate faster than we could do with all the other passive sampler we've been using before, and they provide quick data. But recently, before we came to this workshop last week, there was a spot measurement publication by LASEPA, which is our Lagos Environmental Protection Agency. And when you look at some of the data, like she said, were the data we collected from some of our air quality sensor. And we held a meeting actually looking at it with it was a air queue monitor. And we found that there were missing data in some days. There were also data that are counterintuitive. And we were going to probe further. Of course, like he said, we didn't even have any reference monitor to co-locate it with. But then, when we look at this as a team, we felt we need to probe this further before people just go in there and pick it and do. And that is why for us, we need to be able as scientists and not to ruin the credibility of what we are doing. It would be, just to use an example, many people here will know. SACO, I think they call it SACO, where you have the Turo, the local bus. You will notice that air pollution will be more there and will be bad than compared to this where we are in the university. But some of the data we are getting from our local sensor is saying that this place is unhealthy, while SACO is very healthy. And somebody who is not a scientist just pick that data, publish it, and put something that fake news that has been going around and say, this is it. The danger in that is that people were querying the reliability of the AirQ and saying, we cannot do this. We cannot use this air quality that it is just common sense than this. So for me, why I wanted you to go to that, I'm very glad this is the first time I'm seeing people that have had the experience coming up to say, look, even though these things are good, but these are the limitations. And if there's anything we will need as practitioners, it is how to do more with the PM sensors and see what are the limitations. And also get our government to get reference monitor. Because once you politicize issues like this, once you politicize issues like this, it has a very bad effect. Take, for instance, one of the locations where we put that monitor was going to be a school. The school owner rejected us and said he doesn't want it. We pleaded. She said, if the result came negative, parents will withdraw their children. Unfortunately, we got the resident association to give us a playground. And while we were still monitoring that we are finding counterintuitive data, somebody went, pick a bad data that we are still yet to, without telling us, publish it and put all our research in jeopardy. Then I said we should take it away. So please, my summary is that even the local sensors are good, but we are not yet at the promised land, just like the gas ones you have. We really need to investigate further to be sure that the data we are getting, they are credible and they are things that policy can be based on. Thank you.
Thank you. I think